Why do we get back pain? Does stretching help? And what is the usual rehab process? In this episode of the Health Geeks podcast, we answer those questions. I'm your host, Jing Zhi, and together with me, I have Eric, our physiotherapist. Without further ado, let's get into it. So, first question, why do we get back pain?
That's a really good question. And to be honest, we don't really know. What we know through all of the research and data that's out there available is that 80% of people will get back pain throughout their whole lifetime. And 90% of all those back pain are non-specific, which means that they come not because of any structures that's happening back, but just because of like idiopathic or reasons that are unknown. And the rest of the 10% are obviously pain that comes from specific structures such as your disc, joints, nerves, etc. So in that sense, it's usually quite pointless and unhelpful to go for various scans to find out like what's exactly happening in the back. Because what we do know is there's a very poor correlation between imaging as well as symptoms. So some people can have very, 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 very bad scans, but have no symptoms at all. And then there are some people with nothing on the scans and very, very bad symptoms. And in that sense as well, the human body is absolutely amazing and it's very, very capable of healing and recovering itself. It's a very common misconception, I suppose, that this injury, you'll often hear people say like, oh, I had a slip disc like 10 years ago, 15 years ago, I did a deadlift when I was 15 years old, I'm still having back pain. But we do know that the body actually recovers. And in fact, the bigger the slip disc, the higher the likelihood of it recovering. So on that note, I think it is always best to have a chat with your healthcare professional before deciding whether you want to go for any scan at all. Because most of the time, it's actually not really indicated for you to do all of those things. And through the years, we've moved away from like putting people into very, very tight boxes and like defining what is normal and what is abnormal. We know that the human bodies are full of variation and everyone's going to be different from each other. And just because the way your body is structured is slightly different from everyone else doesn't mean that is the reason why you're having your pain, or that is the reason that you're going to be predisposed for other things. And there's so many people who with all the different variations, scoliosis, all of other variations that manages without any pain and still continues to function as per normal. And there's also no relationship between existing mechanical factors as well as pain. But there are some correlation between poor conditioning as well as like low capacity with your ability to function as well as your symptoms. And the last thing that we know is that back pain is actually a very complex and multi-dimensional condition. Everyone experiences it differently and for very different reasons as well. And therefore, I think some healthcare professionals have moved towards treating it as a symptom and not a condition. And that back pain is actually a symptom of something else. And that is usually something that's a little bit more systemic or something that's a little bit more holistic, whole body in that sense. It can be seen as a protective mechanism. So initially, if there's some degree of injury or there's some degree of danger to your body, the body lets you know that there's some pain as a way to protect yourself and to reduce movement over the area. But most of the times it is because of other factors, because of perceived threats that can come in the form of like stress, lack of sleep, poor nutrition, lifestyle factors, as well as like other work or family related problems, for example. So in that sense, pain and behavioral response actually fluctuates quite a lot depending on your day-to-day life, as well as how you're perceiving your ability to cope with all of these things. It is normal to have occasional pain and niggles around the body. In the same capacity as you don't think that you have a problem with your brain when you have a headache, I don't think you should think that there's a problem with your back every time you have a back pain.
So what happens when this back pain keeps coming back? How does it become chronic, and how do you tell it's like chronic? Right.
Okay, so that's an interesting one. Just in the same sense why we don't really know what causes back pain. We don't really know why pain become persistent as well. But there are some factors that do affect back pain and that can make it to become persistent. I think the easier way for us to go about it is for me to go through some of the common misconceptions or some common thoughts that people have about persistent back pain. Most people think that when you have pain, it's caused by an injury or so your back is hurt. And so in that sense, they often seek health or medical treatment for that sense, hoping that the healthcare professionals, the therapist, doctor will do something to them to help them reduce their pain or make them become normal again. And even worse, if the healthcare professional actually reinforces this kind of notion that their back is hurt or that they have hurt their back or something is injured in there, and therefore you need to avoid doing certain things or you need to stop doing certain things or you cannot do like squats, you need to stop deadlifting, you need to stop doing certain things like for the rest of their life. And all of these very threatening information or education climate actually leave the patient quite confused and fearful that the spine is very, very frail and very vulnerable. And in that sense, this reinforces that protective as well as like very avoidant behavior. So in that sense, they stop doing a lot of things, they start moving like a piece of log, they stop exercising. And so a lot of that movement becomes even more protected and even more guarded. And also, they then have very few coping mechanisms. They don't know what to do whenever pain comes in. And the only thing they can do is just to keep what we call healthcare shopping. So they'll seek one practitioner to another. Once this one outlives their usability, they can't bring down my pain, they'll find someone else or they'll seek a new medication. And then over time, the pain just kind of gradually increases and the treatment or the treatment that you need to go through becomes more and more invasive and they end up doing surgery or something like that at some point in time. But in that sense, the fact is the spine is actually robust and very, very strong. It is meant to take a massive amount of load and it can move in a lot of incredible directions. Just YouTube for like crazy gymnasts. You'll see people moving, like bending their back, stuffing themselves into like luggages, like the spine is capable. You're not that different from them. The only difference is that it takes a lot of exposure and graduated loading for you to be able to do all of these things.
And so like it sounds pretty complicated when you should seek a professional because of the healthcare shopping dilemma, right? So when should you really seek a professional and how complicated can it get before you, or rather, how do you prevent it getting so complicated when looking for a professional?
I think the most important thing is kind of your mindset, the thought that your back is really strong and that it is capable of recovering as itself, and that every time you have pain, it doesn't mean that there is a damage or there is an injury. It's just like if you sprain your ankle, what most people would do is, take some painkillers, ice it for a little bit, and then just give it a few days to see whether it recovers. I think that can be the same for back pain. Keep moving around, do what feels comfortable for you, do what feels good for you. The more movement you do, usually the better it is for you. And at some point in time, if you feel like it's gone and it's been affecting you for a period of time and you can't function as much as you would like to, then you could go for seek treatment at that point in time. Or if you're experiencing some of what we call red flags, means things that could potentially mean there is something sinister, that there is some kind of danger. Things like constant pain, if you have pain and especially night pain that stops you from falling asleep or wakes you up in the middle of the night, and that doesn't change with any kind of position, movement, or even painkillers. Pain that is very, very disproportionate to the level of movement. Let's say, for example, if you're turning and you feel like your back is gonna pop out of place, or like it feels like you've been kicked in the balls, kind of pain. Or if your pain corresponds to a recent injury, recent illness, recent wound, anything that might suggest some kind of like systemic problem and infection, you should seek medical treatment there as well. If you have recent weight loss, recent loss of appetite, other things that could suggest it's not just the back itself. If you have symptoms that's going down both legs, especially weakness, pins and needles, a loss of sensation, definitely seek medical treatment. If you feel like you can't walk, your walking is getting very unsteady, you're swaying quite a lot. If there's any changes in your bladder and bowel symptoms, if you have any changes in sensation around the region, your crotch region, these are some of the examples of when you should seek medical treatment.
Okay. So, for example, right, if I want to self-help,
Yeah.
right, should I get an ergonomic chair? What are your thoughts around getting an ergonomic chair or like using one?
Yeah. Okay. So, like I mentioned earlier, there's no such thing as a perfect posture or perfect body structure. Everyone is a little bit different. Variation is very, very normal. And so in that sense, we have established that, all of these things, even though everyone is different, everyone functions with it. Yeah. And there is no strong association found between like various different postures as well as back pain. Things like proper lifting techniques, ergonomic or workplace interventions have been found to have like not significantly reduced the number of back pain or like pain cases in workplace as well as in the gym. Yeah, so in that sense, I think the best posture that you can adapt is So the best posture that you can adopt is the next posture. Yeah, if be it like a slouching posture, a really upright posture, sitting in odd positions, as long as you keep moving and you keep moving to the next posture, that is going to be so much better than just you sitting straight and upright for like a whole 3 hours.
And how much of like lower back pain is a core strength thing? Because most of rehab is improving like your strength or your flexibility, right? Can we do how much of this core strength thing can we do ourselves? Is it a core strength thing even? And maybe it ties in with my next question. Do we follow YouTube videos online that tell us lower back pain can be alleviated through all these stretches or all these movements or exercise? What are your thoughts on like these 2-3 questions?
Okay. Sure. So let's look at it from like a before injury and before pain and after pain point of view. Before pain, I think doing any kind of exercise that makes you feel happy, comfortable, feels good, it's a good type of exercise. I don't think there's anything you don't need to do anything that's very specific to strengthen yourself. The whole body is generally about capacity versus load. Any kind of conditioning, any kind of like strengthening work that you can do to increase your capacity will reduce your risk of injury because you can take so much more compared to the load that you're putting in. But anytime your load goes higher than your capacity, no matter what kind of movement or what kind of load it is, that increases your risk of injury. And mind you, the load doesn't have to be physical load. It can be mental, emotional, as well as any kind of like psychological load as well. Anything that the body takes as stress. Yeah, this as long as it goes above your capacity, you are at a risk of injuring or feeling some kind of pain. So in that sense, again, before you have any pain, any kind of exercise is okay. Even if you want to go do Les Mills spin class for like 3 hours, or you want to do all of those HIIT YouTube videos, go for it. As far as whether back pain is always a core strength issue, the answer is no. In fact, acute pain often comes in because there's a lot of spasm. So the muscles are actually like working really hard to protect the area. And so doing more core strengthening at that point in time is only going to make you feel worse or more uncomfortable. And then there are so many different kind of classification of categories of back pain. And some of them includes what we call the very active the pattern kind of pain, where the pain is actually coming because there is too much bracing or too much muscle activity over the area. And so in this group of people, you don't need more strength. What you need to learn is actually how to move and how to relax.
And how about the duration of like rehab? Does it correspond to how much pain you feel or how long you have been feeling this pain? What are the expectations you should take when going to rehab for back pain?
Okay, so I think have an open mind, because again, like I feel like there is a lot of misconception or there's a lot of fixed belief regarding back pain. a lot of patients come in with the expectation that the therapist or the healthcare professional need to do something for me, to me, for me to feel better. But a lot of the times, I think taking a very active approach towards rehab or towards recovery, it's much better prognosticated. Means you do get better a lot more quickly if you are a lot more active in your rehab, be it in terms of movement, in terms of exercises, in terms of relaxation, or as well as just doing things that will help you feel better. The duration of the rehab depends on a few factors. Of course, how acute your pain is, how long have you had your pain. The more persistent it is, chances are the longer it will take for you to recover, and as well as the severity of it. How painful do you feel? What are all of the other factors that you have in your life? But the one thing that is most important in terms of a back pain rehab is your perception or your belief towards it. There is a strong correlation between self-belief or the belief of recovery with actual recovery. If you think that, that I've been having this for like 10, 20, 30 years, I am resigned to living with it for the rest of my life, the chances of you recovering is a lot lower than someone who's like, yes, I believe if I do all of these things, I can recover. Yeah. But in that sense, it's like what I was saying, initially, I think what is most important is a lot of movement. Do what we call a movement snack, where you are moving or changing positions very, very frequently, but in a small dose. So 5 seconds every 5 minutes is going to be so much better than 50 minutes every 5 hours.
Okay. I think you kind of answered like my last question, which is what we should do, right?
Yeah.
Yeah. So I think that wraps up today's session. Thank you so much for your time.
No worries.
That's all for this episode. If you have any topics you want us to cover on our podcast, do let us know. If not, till next time, take care.